Good afternoon and welcome to our Open Medical Center Happy Hour podcast. My name is Mandy and I am your host, sitting in for Miss Donna today. I'm very excited to introduce our guest today as we speak about Open's ICU. Alex Rangel is an ICU nurse and has been a part of the Open family since 2020. Thank you, Alex. We are so happy to have you on.
Thank you, Mandy, for having me on. It's a pleasure.
Great. So let's talk about an ICU. Some hospitals don't have an ICU unit, and many people don't actually know what that is. So, what is an ICU?
Well, first of all, we're very fortunate to have an ICU. I can't believe a hospital doesn't have one, but yeah, we're very fortunate. And so basically, an ICU is what's called an intensive care unit. And it's a specialized unit that really treats people with pretty much we call it high acuity, but it's really like illnesses that could put a person's life at risk. They're really high risk for any disease process. It could be due to a trauma, a disease process, like for example, complications of certain things that you can have. And so what we do in the ICU is we get these individuals that are really high risk and we try to take care of them, monitor them constantly. And there's also different ICUs. You know, you can have more specialized ICUs. You can have a cardio ICU, have a neuro ICU. We can have there's some places that have just even ICUs for just the liver. Like that's how specific and get. At Open, we're very lucky that we have like what we call a medical ICU. Get all kind of different types of diseases in there.
So, when you talk about, to having diseases of high acuity, what are some of those diseases that might get someone admitted into ICU?
Right. So a person can be admitted for a trauma, like an accident, and they had a really traumatic blunt force, and it's affecting them, like they have to go to surgery or they're hemorrhaging. People that, for example, we've had people that they're diabetic and they have complications with diabetes, and they have to be on constant insulin drips instead of just being able to manage it with insulin. You can have people that are on shock. So basically their body's shutting down and we have to administer medications that are saving them, or even people that we have to protect their airway and they have to be intubated rapidly. So these are the people that we are taking care
of. Okay. So what should a patient or their family member expect when being admitted into the ICU?
So for the patient, sometimes being in the ICU, it's like out of nowhere. Nobody can really prepare to be admitted as a patient. Things can happen, unfortunately, really quick, and it can go bad really quick. But as a family member, and even as a patient, we have patients that are awake and alert, and they're in the ICU. I think what you can expect is just as a patient, you're going to be uncomfortable in a situation sometimes because we have a lot of things going on. We go in there constantly assess you, take blood pressure, certain things that we do as nurses. And then also it's the unknown, the patients are scared. They don't know what's going on. We can't give them all the information right away because we don't even know. We're assessing the situation. So I think for the patient, just to be, patient as well. I know it's a tough situation, but sometimes, we're also finding out what's happening at the moment. So be patient. And if you have any questions, feel free to ask the nurse, hey, what's going on? What is this medication for? For the family members, if, for example, a patient is intubated and they cannot speak for themselves and they have a lot of tubing, I think for family members going in, the first thing they have to understand is know themselves. How do they cope? You know what I mean? Sometimes a person doesn't cope well right away with visual. And so if they go in there and the patient is intubated and they have chest tubes coming out and they have all these things, and so the person really needs to know, like, okay, if this patient is like that, if my family member is like that, can I see that right away or do I need a second? And so if that's the case with the family members, ask the nurse. If you know that you can't handle visual things like that, ask the nurse first, what is the condition of the patient? What am I expecting to walk into? You know what I mean? And just kind of give yourself that moment to prepare yourself. And also come ready with, in the moment, I know a lot of family members are overwhelmed and they have all these questions. But when you're in front of the doctor or the nurse, you're like, oh my gosh, what happened? I don't know what's going on. I don't even know what to ask anymore. Write down these questions. Feel free to write the questions down. And I feel like that's very helpful. And you can always ask the nurse later on or the next day, you know. Questions are key to knowing what's going on.
Right, right. Those are some great points that you make. I think it is very important to, I guess, get a clear understanding of what it is that the family is going to be walking into as far as the patient before they actually enter into the room. So how long can a patient expect to stay in the ICU?
It really does depend on the severity or the illness that's going on. I mean, some people can be in the ICU for 1 or 2 days, and then some people it takes weeks, months, you know, or we have to send them out to a long-term ICU that they're there for months, you know. So it just kind of depends on the person, what the conditions is, what's needed, if they need to be intubated, if they need like any medication support. So it just kind of depends on the type of disease. Like I said, sometimes you'll be there 1 day, 2 days. It could be weeks. It just kind of depends.
Right. And we actually saw that, you know, during the height of COVID, we have patients who had been in ICU for months. So,
yeah, it's very unfortunate. Yeah, we saw that a lot. We got so used to them. We knew them, even though we couldn't talk to them. And that's what was so hard, that you know this person and you kind of get an idea. You collect the facts from family, whatever you could hear. You know, they will bring pictures and you kind of make up an idea of like, oh, this dad or this mom or this sister. And you have this connection with the patient. And unfortunately, they're there for months. They were there for months and they weren't able to talk. So, yeah.
So what precaution should a person take when visiting someone in ICU? I know you said kind of being prepared mentally or what you could see walking into the room, but what other precautions should someone take?
So it all goes back to what we're treating the patient for, but you know, most important, hygiene. You know, make sure you're clean, you're not sick. We wouldn't want the person is already really sick, the patient, and they're probably immunocompromised sometimes. So we wouldn't want somebody that is sick to visit the ICU, especially now with COVID. You know, if you've got COVID, so we would want to take care of that. Now, I know with COVID, we use our mask precautions. You know, I know on the floors, we're kind of more relaxed, but in the ICU, I still think it would be important because you just never know right now who has COVID. You know, they could still test negative, but you might be positive. I would take those kind of precautions. No children, you know, it's really important. I know sometimes it's hard with family members. They can't find babysitters or the dad is in there or the mom, but, you know, toddlers in general, you know, I think our limit is like 12 years and older. You might be able to visit somebody in the ICU, but you know, children, unfortunately, it's really hard to prevent them to touch anything. So when you go into a patient's room, it's really important to hand hygiene, you know, wash your hands. And it's also very important when you leave the hospital, when you leave these patients' rooms, to clean your hands, wash your hands when you get home. Like even when my job pays, like I take my scrubs off, you know, I don't wash them with my families, and it's all separate, just because you just never know what you can pick up. This is a hospital and there's a lot of organisms that we don't see, but they're everywhere, and we do our best to clean the areas, but you just never know, you know, there's things everywhere. So those are the main precautions. Oh, and then also flowers. You know, I know everybody wants to bring flowers. In ICU, we cannot have flowers. It's unfortunately, we've had to tell them like, I'm sorry, we can't bring flowers. You can bring fake flowers, but just because there's possibility of allergens or little organisms that might be in the flowers that can affect the patient's health or even the other patients. It's not just one patient, we have multiple patients.
That is great. I actually did not know that. That is a good tip to bring up. So last question, what happens after discharge from an ICU?
So when a patient is discharged, we can discharge from the ICU. I know a lot of people wonder, like, can you even discharge or you have to automatically go to the floor? We have seen cases where you go discharge from ICU to the house, or depending on how long you've been in the ICU, every time you're in the ICU, even 1 day can affect your muscles. You will lose tremendous muscles. You don't understand how many people we've seen that say, oh no, but that person was walking and they were fine, you know, like 2 days before they were admitted, you know, and they just lose so much muscle mass just being in bed just 1 day. I think there's been enough research showing that like just one day of ICU bed can decrease your muscle mass rapidly. So you will expect, especially if you've been in like a week in the ICU or 2 weeks, you are going to be expected to do like some kind of rehab. I know that we try to get PT and OT, which is physical therapy and occupational therapy, to work with our patients to prevent that much loss. But you're going through a lot of stress in your body, not only the disease, but you're not sleeping well. And every time, we have to poke you and do things. So expect to be rehabilitated, possibly go to a rehab center afterwards. And that's not even including why were you in there in the first place. If you're there for intubation, you might need to do like rehab so you can heal your lungs, or, just kind of depending that. It's a process. I know it's hard, especially when someone is so independent, to know that, oh man, I have to basically rebuild my body up. So just be patient with that. It takes a while. I've seen where it's taken a year people to completely rehabilitate, 100%. So it takes a while. That's expected. And just follow up with your doctors.
Right, good. And so is there anything that you would like to add, or anything that you think our listeners need to know?
I think in this day of age, how we are thinking is the pandemic is we're seeing less numbers. Just COVID didn't just affect us like as a disease process, but it was more of a community effort. And now it's even more important to be more aware of what you're doing to your body, how you're eating, maybe adjusting your lifestyles. Try to be healthier, because we just never know. COVID showed us that how vulnerable we are, especially if we're not taking care of ourselves. And unfortunately, in our community, we are there's a lot of, population is not as, we don't have as much resources sometimes, and our community was affected big time. So this is a good time to learn, readjust our lifestyles, and just continue to push forward. And we'll be there. We're always there to take care of you. But, we all need to work as a community now. I think that's really important.
Right. And I wanted to commend you and the ICU team, because you guys were phenomenal, and you guys did an amazing job, throughout the 2 years dealing with COVID. You guys worked tirelessly, worked very hard to make sure that we were able to get our patients back and running and healthy and out of the hospital. And some didn't make it, which is unfortunate. But you guys really did a wonderful job and worked very, very, very hard. So we definitely want to give you guys your kudos and commend you guys for all the hard work and dedication that you guys have shown us and the community. So.
Thank you. We are very fortunate. We have a really good ICU. I love everyone. We work well as a team. We're each other's back. And also even the family, they helped us out so much, just like being understanding. It was such a hard moment having the family members like, oh, you can't come in because we couldn't have them over, or, seeing those kind of things. So it really, that's when it really impacts people and humankind comes out. So yeah, we have a great team though.
And so I want to thank Alex for joining us today, and a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.